Welcome to the Monday edition of the Chiefs, and with us right now are I'm not sure if Ami is already there, but Luchi Cruz Valdez, the head of News 5, is certainly with us already, and coming online in a while will be Ana Marie Pamintuan. Hi, and Robbie Alampay of One News. Both of them will be joining us in a few minutes. It's
Yes,
well, it's almost the end of the month, so we're expecting, I think, tonight, an announcement from the president as to
that's right.
whether we move down or up in the restrictions of quarantine.
To MGCQ
Yeah.
or to just maintain GCQ, no? Parang
Mm,
wala naman
mm.
masyadong usapin or alam mo yon talk about us
Ay,
going
hindi
back
naman, hindi naman.
to MGCQ.
Hindi
No?
naman.
So I think it's a question of whether we're going to keep at
Yeah.
GCQ or we're going to downgrade further. So
Mhm.
yeah,
Parang ano 'yan, parang sa Kongreso 'yan, whether it's status quo or ano, o
whether
magpapalit ka.
yeah, isa pang malaking story ngayon yan.
Natahi.
Because there's now a manifesto, right?
Of
And a
two-thirds
manifesto
of
from
Congress,
both majority and minority blocks, no? To
including members of the PDP Laban,
yes, no.
'di ba?
Yung dalawa, yung dalawa, si
Si
Congressman
Pimentel,
Pimentel, who's
yeah.
the spokesperson pa naman, and also I think Pampanga Congressman Gonzales or something.
And yeah,
So
everybody says that's significant, because you have two-thirds plus you have members of the PDP Laban who also signed in. Well,
right,
supposedly, if you believe that manifesto.
yes,
Pero ano, nag-meeting daw yung PDP Laban kanina, apparently to talk about this issue. I don't know lang kung it's everybody's zipped eh. Everybody's
right,
mum dun sa
yeah.
developments dun sa meeting. But they are meeting tomorrow with the president
With President
with the Cayetano camp.
yes, yeah. So ano kayong sasabihin ni Pangulo?
So
Ano?
mukhang
So
mag-uusap sila.
dalawa natin. Announcement tonight, tsaka announcement tomorrow on Congress. But interesting that si Congressman Yap released photos of their small gathering with Congressman Pulong Duterte
Yung
and
kanilang tete-a-tete.
Speaker Cayetano, no? So, parang mukhang may, sabihin na natin, friendship or alliance already, di ba? So, because we were wondering whether the president's children would push for Congressman Alan Velasco, no? So, Lord Alan Velasco. Para pala sila Alan. Okay.
Yung isa lang Lord. yung isa si Lord, yung isa si Peter.
Peter. Oo, mas mataas.
Yung isa,
Robbie's here,
yung
Robbie.
isa Lord, yung isa Lord, yung isa speaker.
Sino masusunod, speaker or Lord? Anyway.
Robbie, what was your big story? The big story.
Malakas yung speaker. Well, ito, pinag-uusapan nyo na nga, di ba? This was obviously the big story, the vote of confidence by the supermajority, basically asking to set aside this gentleman's agreement between Alan Peter Cayetano and Lord Alan Velasco. Also, we're waiting for the president. Tingnan natin, may meeting ngayon. There are recommendations left and right. People are noting that there are signs of a downward trend in new cases for COVID-19, but as we all know, that doesn't necessarily translate to a loosening of quarantine protocols.
Right.
Yeah. Ang punto nga ng Octa Research, it's not necessarily irreversible. So it may be going down. It doesn't mean it won't go up again anymore.
But all we can say is it's definitely going to be better for the economy. At least that's what the business groups are saying. And I think it's the only reason for the pressure to actually declare an MGCQ, no? Because it allows more economic activity to
Yeah, in the short term, at the very least, diba? In the short and the immediate term, it's a boost to the economy. The risk, obviously, is just in case, diba? A worst case scenario na mag-surge ulit, may impact na naman yon sa medium and the long-term economy also.
Right. Yeah.
Okay, Ana Marie Pamintuan is now joining us from the port area in Manila.
Good evening.
Ami,
Hello.
Ano,
Hello.
inabangan niyo ba yung Pangulo, yung talumpati ng Pangulo?
Approve daw yung GCQ 1 month, kaya lang magluluwag daw ng mga business, some more businesses will be allowed. Yun na hindi alam Yun yung balita. Wala pang official announcement, pero yun ang balita namin.
Pero GCQ, hindi MGCQ.
GCQ.
So, magluluwag, ibig sabihin mag-i-increase ng mag-i-increase ng percentages?
GCQ Pero yung meron daw yatang papayagan na ibang businesses. So parang hybrid GCQ na naman yan.
Hindi modified GCQ din yun.
Ibang papayagan.
Modified, hindi lang kasing laki ng modification na inaasahan nyo.
Ganito na lang. MMGQ. Modified GCQ.
Hindi, ano yun? Medyo GCQ.
Okay talaga. O teka, ipasok na natin yun, yung guest natin na ngayong gabi. We have two groups of guests tonight. We begin tonight with our friends, ang ating mga suki coming from UP Octa Research, well, UP and UST Octa Research. Our guests for tonight are Professor Ranjit Rai, Professor Dr. Guido David, and Father Nick Austriaco from Octa Research. Father Nick, of course, is from UST. Kailangan ko lang linawin. Magkapit mga taga-UST.
Good evening.
Good evening, Father. Good evening, doctors.
Good evening.
Well, sir and Father, well, as we did mention kanina, the President is expected to make an announcement tonight kung tayo mag-retain sa GCQ o move down to MGCQ. And there's been some pressure from business groups to move it down to MGCQ. Pero in yung latest report, I was reading the summary, there's one point that struck me: a premature downgrading of the quarantine status in the NCR may increase the risk of a surge in December around Christmas time. So here, I suppose you're talking about if we downgrade to MGCQ by the end of the month. Doc Guido or Prof.
Let me start. So when we were discussing this, what we pointed out is that when the last time we relaxed the quarantine, we went to GCQ was in June 1st, and we had a surge in August. So two and a half months later. So if that pattern continues, and we can only learn from past patterns, if we are not careful and if we release the quarantine too quickly on October 1st, then if the pattern repeats, then we would expect a surge around December. And so you see, we're just simply looking at past patterns and trying to understand what could possibly happen in the future.
Pero Father and Professors, are you saying we should do a status quo? Kasi what we're hearing from Ami from the Philippine Star is maaring we stay with GCQ pero may ilan pang pagluluwag na gagawin with some industries, which I suppose is a modified kind of GCQ din. Yun lang, hindi siya kasing luwag ng MGCQ.
Do one of my colleagues want to answer?
Yeah. I think Ami heard, right? I had a short meeting with some members of the NTF, conversations with them the day before yesterday and yesterday. And I think the consensus, not only with some of the members of the cabinet and also the mayors of NCR, the big question here is NCR. Okay, in other places, I think the conditions are much better, and they can easily move to a less restrictive status. But for NCR, which is the big question, where the epicenter of this pandemic continues to be, it's clear from our mayors, from some of our government officials, that I think it's fair it's right actually to sustain a GCQ status until we improve our health indicators here. And they are improving, by the way.
Yes. Mukha namang nakikinig sa inyo yung mga policy makers natin Kaya lang, yung of course, we can expect the economic cluster to push for the revival of the economy. May mga binabanggit silang mga sectors in particular na kailangan dagdagan na yung buksan sa retail, tourism, travel, film, the performing arts. Saka medyo pagluluwag pa ng konti sa transport, pinupush nila. are there any particular sectors of concern for you? Kahit mag-GCQ, mukhang mag-GCQ pa rin na matagal, pero mukhang gusto nilang dagdagan yung mga activities na papayagan na. Are there any sectors na you are concerned kung papayagan na nga starting October 1?
So let me answer that.
I think the tourism and transport sector are key. Okay.
Yes.
So if you actually look at the data for September, there is a very interesting spike in cases on the 17th and 18th of September. So if you look at that, it's actually about 300 more for those 2 or 3 days in a row, which is very surprising until you look at the mobility curve for the NCR. And you realize, if you remember, around the 12th, the Department of Transportation announced a loosening of the shortening of the social distancing. And so for 3 days, we had shorter social distancing. And you can actually see a spike of several hundred cases in those 3 days. So this is why we have to be very careful. We only it was an experiment. We relaxed for 3 or 4 days, and you can actually see a very small spike of several hundred cases about 4 or 5 days after that, which is what you would expect if the increase in mobility will lead to infection. So this is a little experiment we tried in September, and you can see what happened. And the concern is that anything that increases mobility drastically will
Father, if you don't mind, I want to put a fine point on that. No? I mean, this was the time, as you said, where there was some confusion as to whether or not we are going to change the minimum standards for social distancing in public transport. This, in other words, actually at that time, to qualify it, it wasn't really clear if this was new standards, but clearly this was the communication, and it caused a lot of confusion. What I wanted to point out was it's not necessarily policy. It's not necessarily. It was pure communication. It was the impact purely of communication. Is that a fair statement?
Robbie,
So
it
I
was
think
implemented for
it
3
was
days.
implemented for 3 or 4 days.
Okay.
You can actually, in the Apple mobility data, if you look at the Apple mobility data for the NCR, you see a spike in mobility for 3 or 4 days. So you actually know it happened. So it happened. There were more people. It was about a 10% increase in mobility. And that 10% increase in mobility resulted 5 days later to 300 or 400 more cases than expected.
Wow.
So, again, we have a little experiment already. So if what will happen in the NCR, we have to be very careful. We have to be very gradual. I think it's important. I agree that the economy has to be there. But if you look at elsewhere in the world, one of the things we have learned is we have to be very gradual. You change something, you wait 2 weeks, you watch something happen. Then you change a little bit more. So you change it gradually, and then we wait to see the impact. I think that the danger is if we change too much too quickly, we will not be able to see the effects until it's too late.
Okay, very basic question, Father. Very basic question lang. Sorry, Lucy, mabilis lang. Gusto ko lang maintindihan, for our own education, next time we notice things like this, the 4 or 5 day gap, as you said, is that a good guidepost? If we notice anything in the numbers, that's a good exercise for us to think what happened 4 or 5 days prior.
So usually it takes 5 days for 50% of the population to show symptoms.
Right.
So what will happen is that's when you expect they will go to get tested, right? So what I noticed is the spike first. I said, why is there a spike? And then I went to the mobility, and then I noticed there is a spike in mobility. Then I Googled what happened on that day, and then you can see what happened on the day. So you have to look for patterns in the case. And so anyone can look at it. The data is there. The data is there that we changed it for 3 or 4 days, and we saw a spike in the number of cases.
Okay, so
down because we shut it down after 3 or 4 days.
Right. So to follow up on the question of Ami, no, what other industries or guidelines in industries or sectors of community uh, are you going to uh, expect some impact from if they are loosened?
Uh, I think Lucci, that's already been. I mean, we haven't seen this yet, but there are already studies. I think Texas Medical Association is one of them that certain activities which are parang connected to mass gatherings. These are usually the highest risk of activity. So this would include concerts. And so when you mentioned yung mga film, I would be a bit worried about that. So something that involves a lot of people. I mean, for example, a gym may not involve so many people, but a concert or a movie house,
Church.
a
Math,
church, a
yeah,
mass with a lot of people. Those would be risky activities based on studies already done outside the country. So those would be something that we should be very cautious about. And yung nangyari sa public transportation, that was in a way enabling congestion and we're enabling crowded places in a public transportation, and that as we have already mentioned in a previous interview with I think Father Nick mentioned that by decreasing social distancing, you're also crowding your buses and your trains. So and that could lead to more transmission.
well, what about this debate now over whether to allow face shields in factories and in workplaces where you know good vision is necessary for actually undertaking any kind of activity. They were talking about like in factories that deal with very very small parts or construction, for example. It's going to be very hard for construction workers to be putting on a mask and a face shield while, hammering away or doing their thing. What about those kinds of activities? Do you think they're going to have an impact on the numbers?
Actually, I haven't,
Yeah,
yeah, I haven't seen
yeah.
any
I mean,
construction workers.
construction. Yeah, heats up.
Yeah, we're
Actually,
yeah. See,
debate
Hold on.
kami.
yeah,
Pinag-aawayan ko eh.
I let
Yeah.
Professor Ranjit handle this one, but I haven't seen any construction workers wearing face shields actually. So,
Medyo mainit.
Actually, that's the problem. I haven't seen myself. I haven't seen myself, but in Taguig, it's well documented. A construction site became an epicenter for community transmission, and it really, that's a perfect example of a enclosed or crowded space, and it's really up to our health experts and government to set guidelines for this, no? And it's actually a major issue with the private sector. Up to what level should they provide, no, to ensure safe workplaces? And the government will set the guidelines, but the compliance will be with the private sector. And when you look at our data, past and present data, you'll see that the greater number of people who are getting sick are from the working population. So there are two places where people get sick. No, they get sick because they go to certain workplaces, and they get sick in their own communities, in their own homes. So this is we're seeing good numbers, but we're not seeing numbers that would convince at least our team that we should loosen, okay, significantly our restrictions. And so that's why I was saying earlier, I think if there are some industries that we need to be very careful about opening or providing stricter guidelines, transportation will be one, second be tourism. So we need to really work on these things. No? The other industries that are going to open or expand are not so much of a problem for me, apart from safe workplaces, offices, and factories, and of course, transportation and tourism. These are the key areas which I feel will create, more vectors for transmission. Imagine we're going to open up provincial bus operations. No, that has to be monitored very closely because we might, there's still a lot of cases. Yes, we have gone down significantly over the last month or so, but the caseload is still high. The virus is still here. And if we're not careful, we might be transporting carriers all over the country through provincial bus lines.
Oo nga.
Professors,
Sir, what
what
about
about
retail?
film production? Kasi kasama din yon. It's one of the recommendations of DTI. Film production, not necessarily opening up movie houses, but resuming production and some performing arts. Although hindi live audience or limited audience, is it possible to begin to resume although I think there is some production going on now. Pero mas dadagdagan pa daw, mas pababayaang buksan yung
So
industry. Is that a problem?
let me respond to that. So there are countries in Asia that have resumed production of TV shows and movie shows, but they have embraced social distancing along with that. So everyone else wears a mask except for the actors. So it's not an either or. It's a question of, can we allow these industries to function with the appropriate social distancing policies in place to prevent them from triggering a spike. And remember, and one of the things that our team has talked about is we're talking about antigen tests. And this is the kind of area where you could imagine an antigen test which will give you a result in 30 minutes, right? And the cost of it is relatively inexpensive compared to swab tests, where you could implement this kind of testing at a production site.
Oo. Oh. But until now, Father, parang wala pa ring decision on whether the antigen test will be marked as an acceptable standard for tests. No, government is still they would rather still hold to the PCR standard as the gold standard for testing. How do you think that will go also?
Well, I agree that the swab test, the PCR test, has to be the gold standard. But I think one of the things that's really important to acknowledge is that if you look at the way that antigen tests have been used in other countries, if they are used properly, they can be used as initial screening, right? So if you have symptoms and you test negative on an antigen test, I don't trust that test. You have to go get a swab. But if you are positive, even if you have no symptoms, the likelihood you are positive is practically 100%. And we're trying to identify the asymptomatic positives and try to prevent them from spreading. We will never be 100%, but can go a long way, a lot better than the antibody tests, because the specificity rates are much more robust for antigen tests than antibody tests. So, and I understand I'm being tested in Baguio already, so I'm hoping that the news will be positive on that in that regard. So we will see, but my hope is that in the next month or so, we will begin to deploy these antigen tests around the country, and that will help us to ease our way into an MGCQ here in the NCR.
Dr. David, the last time you were here, we did take note of the encouraging numbers for NCR, but what are you seeing in the surrounding areas now?
Yes, Robbie, that's a good point. So NCR, we have had almost I think more than 1 month of the decline in cases. However, in Calabarzon, there was actually an increase just the previous week, and that contributed to an increase in numbers there. Although this week nag-decrease na siya, but it's only a 1 week decline. So I think we have to monitor these provinces closely. And that includes Cavite, Rizal, Batangas, Laguna, and also Bulacan. They're also getting more than 100 cases per day. So it's about on the same level as Bacolod, Negros Occidental, which is also getting more than 100 cases per day. But Bacolod has at least improved slightly. So the caseload is decreasing, and the positivity rate is also decreasing. But still, we still have to be, we still have to monitor these areas.
Yung R0 ba, I mean, you make the point that yung R0 sa Metro Manila and in nationwide is below 1 at this point. Is there meron bang particular areas where the R0 is an outlier and is higher than 1, or at least more concerning compared to the other regions?
Yeah, any of the emerging hotspots, Robbie, will have an R of greater than 1. So, for example, if they had a 2-week increase, and I think among the regions, I think Benguet has had a 2-week increase. So I'm sure R is greater than 1 in Benguet. But at the same time, even though they had a 2-week increase, their caseload is still very low. I mean, it's still relatively low compared to in Metro Manila, where we're getting 1,000 cases per day. They might be getting 20 cases per day or 30 cases per day. So it's not disaster yet. So, but we definitely have to monitor these areas. And I think even Batangas, Laguna, the R is greater than 1 in these areas because of the increase last week. Although again, the trend has started to stabilize, but they still should be monitored by then.
Sir, there's another city that you listed as an emerging hotspot, maliban dun sa Baguio City, is also Cagayan de Oro. What are the numbers there?
Yeah, there were also increases in Cagayan de Oro. I think as of the latest week, it has stabilized, meaning it has increased significantly. But yeah, so Cagayan de Oro and a few other places. I think Leyte also is one of them. So definitely we have to monitor these areas: Cagayan de Oro, Benguet, and Leyte. And I think, well, I mean, they change every week. So we just did the report a few days ago, and then suddenly we did the report, and the emerging hotspots changed already. So these are up and down places, and that's why we have to monitor them. But it's not necessarily alarming when we see an increase in any of these places. So we just have to, monitor them and try to determine where the transmissions are coming from.
So if we have another month of GCQ, where do you see COVID cases at the end of October? Meron na bang ganong projection? Another month of GCQ in Metro Manila lang. Sige, Metro Manila only.
Well, actually, we have it for the whole Philippines. So
okay,
that's
good.
Yeah.
Okay, end of October. Where do you see us at the end of October? Kung one more month of GCQ dito sa mga hotspots.
Wala si Professor Ajit. I thought you wanted to answer that. But anyway, we're seeing about 380 to 410,000 cases by because we're still getting mga 2,000 to 3,000 cases per day. So they will still add up. So it will, before it improves, we'll still get a few more cases. Pero it's very possible we miss the lower range of the estimate, the projection. If we reach below 380,000, that would be very, very good, actually, because we're going to hit about between 310 to 315,000 by end of September. So if we're only adding 70,000 new cases, that would actually be a good result for us.
Hi, Doctor and Father, nabanggit natin yung Benguet specifically, Baguio, of course. Can we pin this on the efforts as well to reopen Baguio to domestic tourism? Is there a cautionary tale there for places like Boracay and Bohol who are looking to reopen to tourism in October?
Well, Ali, for me, you have to look at the data, and I have not looked to look at the causal data, and you have to actually determine if there is a spike. If you, again, like we did here in the NCR, are there very specific times when policy changed that would increase mobility in the population? And I've not had a chance to do that. That's one of the things I can do this week.
Father, can the churches handle more people inside? Because we can see during masses, there are a lot of people outside, pero siyempre people want to go inside. Can the churches handle more people now?
One of the challenges with church is there's a lot of vocalization. So there's a lot of singing, there's a lot of talking, which means that droplets are being spread everywhere. See, that's why throughout the world, religious gatherings are particular hotspots for super spreaders. It's because of so much talking. So the priest is talking, you're talking, you're singing the Alleluia. Basically, all of that droplet is moving around. And if one person is positive and you're there for 1 hour or 45 minutes, the chances of you getting that increases, which is why you prefer the outside, because when you're outside and singing, you have the entire atmosphere to absorb all of that droplets.
Okay. So, okay na sa inyo yung capacity ngayon. That's about 30, no? 10 to 30, depending
I
on the
believe
place.
it's 30. I believe it's 30. So Santo Domingo, we have the fiesta at Santo Domingo for Our Lady of Naval next week. And so that's going to be I'm going to be there. I want to see how that plays out in Quezon City and what will happen there.
Oh,
I'm
no,
sure.
Professor.
Father, bakit ganon? Akala ko ba you're discouraging the commemoration or celebrations of it?
Yeah, so no, well, I've had no personal say in what is happening in that church. I know that they're doing it as a community. I think they're preventing people from coming, but I'm concerned people will still come.
Yeah, they probably will. Devotees here. Yeah.
They closed the church, they closed the gates, but Filipinos are deeply passionate about Our Lady. So we will see.
Oo, parang sakyapo. Kung mag-MGCQ, I will ask for projections again. Kung maging MGCQ, where do you see us at the end of October for Metro Manila?
Yes, actually, Ami, that might be a bit tough right now to answer because we haven't seen what kind of MGCQ we will have. It's very possible that we will have a surge and we will get more than the 410,000. And we're concerned about the reproduction number because if we have an MGCQ, that might start pushing the reproduction number close to 1 and maybe above 1. And when that happens, kasi once your reproduction number becomes greater than 1, sometimes it just creeps on you. And it happened in June and July. Your reproduction number was greater than 1, but our caseload was still small, pero we thought we could handle it. And then suddenly, biglang magkaka-surge na lang because it's already on a snowballing effect. And that could happen. I mean, it might be that the number of cases is still, maybe 400, more than 410,000. So it might seem like we're doing okay. But once we get into that snowball, sometimes it's difficult to stop it. And that's one of the challenges here. And that's why we want to try to keep the trend in a decreasing trend and not take risks of any changes that will lead to a surge in cases.
Okay.
Doctor,
All right,
Professor, Father, we'll just go into a gap po. So we hope you can stay with us when we come back. So yun po, we'll just go into a gap. Please stay with us.
Welcome back to the Chiefs. We're now in the final stage of our conversation. And still with us are UP Professors Ranjit Rai and Guido David and Father Nick Austriaco of UST. All of them are members of Octa Research. Welcome back, gentlemen. Tatanong ko lang, no, kasi ngayon, people are now preparing, we're entering October, the final quarter of the year, and everyone is wondering what our Christmas is gonna be like. Nilalabas na ng mga mall yung mga decoration nila, all the promos are there, and are you worried about all these preparations? People are looking forward to having a Merry Christmas, whatever this pandemic brings. Are you worried about any particular activities as Christmas approaches?
Okay, I will start. I'm the priest,
My
so
worry, Ami. Okay.
I would say, look,
Okay. Okay.
I am very excited for Christmas too.
Yes, yes.
And I want Christmas to be as near normal, but as COVID safe as possible. You see, that's the thing. So my hope is that as we prepare, our goal should be all of us should prepare for Christmas. So hopefully we will relax the quarantine around Christmas, but our testing, our contact tracing, the caseload numbers will be down, the reproduction numbers will be down, the positivity rate will be down. So for 3 weeks around Pasco, we can be relaxed, and the caseload will be down that we can actually enjoy and celebrate the Savior's birth. So the question now is, if to prepare for that, we have to be patient, right? And I will now give it to Professor Ranjit to talk about the other concerns that we have.
Professor Ranjit, the pessimist daw in the group.
Actually, because Father is always with us, I'm becoming more optimistic because of the numbers also.
Sige.
The fact of the matter is, I think, I share, Father's position is shared by our whole group. And you'll notice of all the project groups doing projections, we always include Christmas. There has to be a goal to all our hardships. We still have a long way to go. The fight is still until the next year or two. And the COVID-19 is still here. The worst thing we can do is overestimate our achievements as a people and as a government and underestimate the virus. And if we do that, which I fear some of us tend to do, we will not enjoy a Merry Christmas. No? So we still need a lot of work as far as compliance with the minimum health standards as citizens here, especially in NCR. That means physical distancing, the wearing of face shield and face mask, proper hygiene. And for government, we really need to scale up. And there's a momentum now, and I feel the concern of government also after talking with them that there might be this perception that things are getting better and people can be overconfident. And so that's the worst thing we can do now. Underestimate the virus and overestimate our achievements.
Pero Prof, yun nga po what should be the trigger? What numbers should trigger the loosening of quarantine restrictions? Let's say come Christmas time. Should it be a 28-day case doubling time? And if so, how long should that last? I mean, how long should the trend be before you trigger MGCQ, for example?
So let me.
The government is we had the same conversation yesterday. What are the benchmarks? No, and our group has been consistent. There has to be at least a 2-week decline in new cases. There has to be at least the positivity rate going down to 5%. There has to be enough testing and PPE for healthcare workers. And systems to deal with a surge have to be in place. So increased hospital capacity. That's our own benchmark. If we can get it down to that, then maybe we can consider. So in actual numbers, we should have less than 1,000 cases a day on the average for that to happen. And for that to be realized, you have to scale up testing, tracing, and of course isolation.
Do you think the home quarantine rule really helped, and should it go on being practiced, especially in light of the fact that the number of hospital beds or isolation capacity is not really growing at a rate that we want it to?
So let me respond to that. So all the data, especially data from Hong Kong and Taiwan and from other Asian countries, have shown that a public isolation and quarantine facility dramatically decreased transmission because the primary area of transmission for COVID is in the home. So the secondary attack rate in the home is the highest. So especially in the Philippines, especially in some barangays with a lot of urban poor, it would be a challenge for them to maintain the social distancing that they would need in their home, let alone in their neighborhood. So if we really are serious about this, we have to do what our other Asian neighbors have done consistently and shown to us works.
But that also means that hospitals and isolation facilities will have to increase their capacities, right? Even now, hospitals are being asked to add to the number of beds that are dedicated to COVID patients.
You are correct. So whether or not it's the hospitals or whether or not the isolation and quarantine facilities have to be increased, somewhere there has to be more room made for the increase in people. However, as we've said many times, the caseload is dropping and the caseload is dropping dramatically. We're already at half the caseload that we were at the beginning of August. So the idea here is as the caseloads decrease, the demand on these quarantine facilities, hospital beds should also come down.
Mm. Yeah.
Hey, Father, and Dr. David, can the mathematical models theoretically picture or imagine a scenario where the numbers go down to zero? I ask this by way of trying to not politicize your statements. As we know, Malacanang has a sort of a word war going on with the vice president. The vice president very categorical and very emphatic in saying we can defeat COVID even without a vaccine. Malacanang, to oversimplify it, also is saying no, it's not going to happen. Bottom line is we need a vaccine. So let's not talk about beating COVID. So that's why I frame it that way.
So
How do you settle that debate mathematically? Is it possible to imagine the numbers going down to zero?
just look at the world, right? So there are two approaches to COVID. It's called mitigation or suppression. And the countries that have been able to suppress, say for example, New Zealand. So New Zealand is the classic example of suppression. Say for example, Thailand. What is most critical is you must make this decision very early on. So New Zealand will lock down the entire country when they have a daily caseload of 70 in the entire country. So and they close for 1 month. So there is it possible to suppress? Yes, but we have to have a lot. We are already dealing with 2,000 a day, so we would have to take maybe 6 months of total ECQ to do that. And I do not think anyone wants to do that, you know? So now we have to ask, can we now begin to try to suppress in particular islands in the Philippines? That I think is realistic. Can we take provinces where the caseload is low and attempt to suppress? Yes. At the NCR, it will be incredibly challenging.
Yes, but Father, but Father, I'll take your example about suppressing in particularly in Ireland. What does that mean for the efforts to reopen domestic tourism? As we said, Boracay has already announced they will start to reopen. Bohol is following suit. What does that mean for this particular very crucial sector for our country?
Well, so again, let's go and look at the experience of the world. So if you look at New Zealand is closed to tourism until the vaccine arrives. So what they're telling us and what they have taught us is you get to choose. You get to have tourism or suppression. You cannot have both. So now what we're saying, therefore, is that we should all agree we are going for mitigation. Because right now, if we want to sustain our economic structure, especially tourism, suppression is not a realistic goal. And so now let's all get together and decide, all right, let's now mitigate. What does that involve? And our goal as a team has been to provide government, provide LGUs with the data they need so that they can have evidence-based, science-based policy to mitigate. Uh, we are not here to suppress. We have never really talked about suppression, but we're talking about, as you heard Professor Guido pointed out, we just want to keep the R below 1. That's the key. If you keep the R below 1, you mitigate the pandemic. It will go down. It will go down slowly. It will take a long time, but it will go down.
Professors, are you following developments on the saliva test? Because there are several groups now, private sector in particular, who are moving to get the saliva or spit test or whatever you call it in the Philippines. It will give you instant results. And I've been told it's now being used in Japan, for example, spit test, and it allows them to travel, to open schools. Are you following this development? How will that affect our response to the pandemic?
Does anyone want to answer?
Professor
That's a
Mike,
game changer.
yes.
Yeah. Okay.
Go negotiate.
Well, that's a game changer. No, one of our fellows,
Yeah.
Dr. Michael T, is part of the Red Cross
Yes.
consortia, pilot testing the swab test using the University of Illinois model or protocol.
Yeah.
And it's a game changer because can you imagine taking a saliva test and in 15 minutes you get the results and the effectiveness, no, the accuracy is almost as good as a PCR test. That's a game changer. We don't need to lock down anymore. We can just go to a concert,
Yeah.
pay for a ticket, take the swab test, I mean the saliva test, and then come in. No, but of course, there are there are limits to this, and so it's still being tested. But it's a game changing. The antigen test is another one. And in fact, we've suggested that other LGUs take this seriously. Father has been doing some research on antigen tests.
Father?
Well,
Yeah.
Father,
no.
yeah.
Well, it's just that particular people from LGUs have asked me to investigate particular test kits from South Korea.
Yeah.
And one of the things you discover is that it really depends on the test kit because different test kits have different specificity. So it's not just about antigen tests or spit tests. It's which kit, which manufacturer, and you have to know exactly what you're working with.
Oh, yeah.
So
That's
there's no
the
standard,
government.
Father? There's no standard for all these tests?
So what is happening actually is different countries are establishing standards for these tests, right? So the CDC in the United States is currently doing this. I think they have an emergency authorization for 3 antigen tests already. So we're waiting now for the DOH here in the Philippines to release the guidelines for which tests would make the minimum threshold for specificity. So we will see.
So apart from testing capability, what else do you want to see in the coming weeks in terms of the government's response to the pandemic? What's
I
missing?
think it's budget season, and a lot of the budget has been.
Yeah.
Yeah, it's budget season, and I think there has to be a louder conversation on allocating more and more of that budget, increasing capacity of our healthcare system. Our big challenge this month has been, and the reality is in NCR, we could have opened up, but 50 to 60%. Can you hear me? Yeah.
Yes,
Yes.
yes, of course. Yes, we can hear you. Ano yata, maybe Professor Guido, maybe you can fill in. Pareho yata kayo ng sasabihin.
Well, actually, Ranjit
Yeah.
knows more about budget. Wala akong alam sa financial
Ako
aspect.
Hey, kayo, what do you want?
Yeah.
Well, let me say this. So I was speaking to the UST School of Medicine and Surgery 2 days ago on Friday. And one of the things that I discovered, because I was asking about their beds. So I was, they're at about 100% bed capacity for COVID. And they've been this for the last 6 months. And I said, have you considered increasing the capacity? And he said, well, it's actually not beds, it's staff. So, and one of the things we've discovered as we've talked to LGUs around the country is that the limitation is staff. There's not enough doctors, there's not enough nurses to provide the care if you open the beds up. And so I think in terms of budgeting, one of the things I think I would emphasize, and I think our team would emphasize, is to try to find a way to increase the number of people, healthcare workers in our hospitals. We were talking to some public health authorities from Rojas City, and they were saying, they increased the salary. They could not hire anyone to come. And so the question now is, what do we do? You can have beds, but there's no one to take care of the patient in the bed.
Mm-hmm.
Professor is back. Professor, you were saying about the budget. Professor, right?
It's budget season, and we need the doctors. And hi. I'm sorry. My internet's. I overestimated the strength of my internet. No. Okay. So it's budget season, and I think it's high time that we elevate the conversation about healthcare capacity. And that's not. And Father is correct. It's not just about beds and ventilators. It's really about people. It's about healthcare workers. We cannot deal with a surge at the moment. Okay, it's very clear. Okay, and this is a position that's shared by even the members of government that I talk to. Right now, we need to scale it up, and then while we are in this downward trend that we're trying to sustain, this scaling up has to happen. But there's a big conversation now emerging in government. The key problem for some, a minority of thinkers in government, is that the local government code, the decentralized setup we have, has created a challenge as far as healthcare is concerned, and there is a call for decentralization of healthcare. It's a serious discussion that I think that merits a significant debate. The pandemic has exposed the problems of providing healthcare in the country, and some people are suggesting the challenge is because at the provincial level, that's where DOH ends. When below that, the DOH has a problem already. So, you cannot have standardized ways of dealing with things because you have so many of these veto constituencies at the local government level. And a lot of them have a different view about how to use their healthcare systems. And guys, it's a real problem, the politics of it. It's true. Pandemics are here to stay, and it's a challenge for our humanity. But bad governance really exacerbates pandemics. And, I would like to talk about the details that I'm hearing from different local government units, about governors fighting mayors, about the lack of coordination as far as the use of healthcare facilities. It's a real problem here in this country. And a lot of the surges we've seen over the past 2 months have been exacerbated by the failure of governance in these local settings. The failure of politicians and political families to go above their trivial parochial politics and to deal with the pandemic in an effective sense.
Professor Rai, it's a fascinating discussion. I think you opened up a can of worms. I imagine we'll need one entire episode to talk about this. But I mean, just to poke a bit on the other side of that conversation, and it doesn't necessarily limit us to the matter of health workers. But isn't it also part of the conversation that a lot of the confusion at the start was no clear signal and no clear leadership from the national government? And therefore, a lot of innovations actually came up from a lot of local governments also. Isn't that a fair statement to make also? That in a lot of ways, a lot of local governments actually shone with their innovation and their example and their leadership.
Marikina is a good
That's true. I
example.
agree. A lot of local governments are winning the war. I mean, local governments are going to win the war here. I mean, the national government has clearly, rolled out its strategy using the local government. So it's the local governments that are going to be at the front and center of this next phase of COVID mitigation. It's really the national strategy is the local government. The local government takes care of everything. And in a sense, there are very good local governments in NCR, but it's not uniform around the country. Local governments in NCR are rich. Most of them are. I mean, you talk about Pasig City, you talk about Quezon City, which, by the way, is the big story, in NCR. The city of NCR is now regaining, and restoring itself, no, resetting itself. The pandemic is on a downward trend in Quezon City, and a lot of it had to do with leadership. Okay, and so, but this is not uniform around the country. Local governments are not the same, and you talk about Rojas City. It isn't as rich as some of the cities here. So these are the real challenges, Robbie, and it's true. Innovative leadership, you can see it everywhere in the NCR, is winning. The war against COVID. There are more cities now that they are managing it better. Look at Caloocan. Look at Navotas. They were plagued with this virus. Now they're beginning to reset. And quite surprisingly, Makati is not doing very well.
Okay.
Well, actually, the question there is,
Okay.
since we're talking about the budget in Congress now, no? So what do you suggest, for example, in terms of realigning budgets so that more monies go to especially the provincial LGUs?
Yeah. The budget for health is fourth, in the list of priorities. I
Right.
think now, given the challenges we are expected to meet as we open up the economy, surges and the like, we need to put more budget into building hospitals, getting more health workers, hiring more health workers. We need to get more budget for research on COVID. We need to get more budget to empower LGUs. I think that's the key for me, and where the budget is as far as the health sector is concerned, it's priority number 4 or 5. Still more budget is going to build, which I think is part of the strategy of our economic team to jumpstart the economy. But I feel more money should be allocated for building capacity. The surge is going to come. This COVID-19 pandemic is going to be here for at least a year more, and we need to prepare for that surge.
A year more. Oh, no.
Okay.
Paano na lang ang simbang gabi, Father? Paano na lang ang simbang gabi? At paano naman yung simbang virtual na lahat talaga.
Simbang gabi na.
Zumbang gabi na yan, Zumba.
Okay.
Ay, nako.
Okay.
We look forward to Christmas, We are hopeful people.
Okay.
We will pray for
Let's work at it. Yeah. I think we can do it. Yeah.
Okay.
Okay, thank you po,
Okay.
Father Ranjit Rai,
Thank
and
you.
Professor Ranjit Rai, Professor Guido David, and Father Nick Austriaco of Octa Research. Maraming salamat po for joining us tonight.
you.
Thank you.
Salamat po.
Thank you.
Maraming salamat po.
Right.
Okay.
Interesting, in 5 days, they saw the spike.
Oo,
Yeah.
di ba?
Wow.
Yeah.
And all he did was backtrack.
Yeah.
And but hopefully that settles that.
Oo
Di
nga.
ba? I mean, di ba?
But ako lang kasi, what's surprising lang kasi is that yung 3 days na yun, we are only talking about reducing the distance by 1 foot
Yes.
to 0.75 of a meter from 1 meter.
Lalo na pag
Basically,
naging
a
0.3,
little
no?
more than a foot. Yeah.
Yeah.
So
Yeah,
ganun na rin eh.
but that was, I mean, Lucci made that clear. No, it was an actual implementation. It was an actual experiment. But the point of my question precisely was there was also confusion on top of that. Diba? I mean, between 0.75 to half to 0.3 meters, diba? And I'm sure within that experiment, it gave a lot of
0.75 yung isang metro. Gano'n kalaki?
diba?
Ano nga yung mga police meron pang measuring rod, di ba?
Tape measure ba?
Ah,
Okay, overtime na tayo.
Waiting for the announcement. Sige na.
And that will be all for this Monday edition of the Chiefs. What was discussed here, we'll keep the conversation going. I'm Edwin Gao for News.
I'm Ami Pamintuan of the Philippine Star.
I'm Lucy Cruz Valdez, News 5.
I'm Robbie Alampay. We are One News.